I wanted to follow on some of the questions Paul has brought forward, and I think you made some really important points there, Alison, because at Local Government Committee, which Paul and I are also members of, we heard that two examples of good policy making around co-design has been ending homelessness together and also the promise, where actually you've been brought in at the very beginning of this process, not at the very end. So I wanted to specifically ask, how do you think the Scottish Government can, given the process they've decided to use for this, make sure that we don't see the National Care Service potentially destabilising for care users and their carers and the workforce wider as well? And where do you think that co-design is actually now going to come in during this process? So I mentioned you specifically, Alison, so happy to put that back to you.
I suppose it goes back to the Social Work Scotland position that we think the co-design should take place prior to the bill to allow that real sense of people being involved and engaged and being able to, I suppose, address some of the concerns and issues that are out there. And that doesn't stop actually addressing some of the key concerns that the National Care Service wants to deliver. So there is nothing to stop some greater collaboration, better ways of working, looking at terms and conditions of staff in amongst some of that and how we do that. That there are mechanisms without the bill that would allow some of the key elements of that to take place. And I think actually having a workforce at this point in time, as we've said, we already have significant vacancies in social work staff and certainly in social care. We are struggling to recruit. There are real challenges that other panel members have already mentioned in terms of the terms and conditions for social care staff, certainly. We see challenges across the country, so the differences between urban areas and rural areas and the recruitment challenges that we face across those are slightly differently. So there's nothing to stop us doing some of those things whilst we're doing the co-design process. But I think it's needing to understand better. I think the challenge with doing the bill and then the co-design process is that we spend a lot of time in that co-design process then looking at structures rather than spending that co-design process looking at what would make things better for the people that we support and for our communities and for our staff in terms of making sure that we get people in, because it then becomes a structural type of conversation rather than a conversation around where that is. And particularly for social work, there's also a challenge because we have and we really welcomed the fact that there was a decision that stuff around children's services and justice needed further analysis. But there's a challenge then that the National Care Service is designed around adults to begin with children and justice coming in at the later stage, rather than those key decisions being made in a National Care Service being designed around the totality of what ultimately will be part of that National Care Service. So, as I say, it's around getting the right conversations. Otherwise, we make decisions about what should be included in a health and social care record, for example, before we make the decision if children's services is part of the National Care Service or not. And the type of data that is held within children's services is very different to some of the others. So it's around, as I say, those interdependencies in those discussions we need to have, that we need to be mindful that we, I suppose, take the right amount of time to have those discussions rather than feeling constrained within the parameters of a bill.
Sure. Yeah. Does anyone else want to?
Yeah, I think it's probably fairly evident within the bill that it's quite light in detail, and that is maybe reflective of the fact that that co-design process maybe hasn't taken place. Particularly just thinking about the voluntary sector and how complex that is. I don't feel like that complexity and the contribution that the voluntary sector makes to care is reflected adequately at the moment. And I think, just following on from what Alison said, well, from what other panel members have said as well, maybe now is not the time. It's going to be quite a challenging time to meaningfully do that co-design. I mean, the voluntary sector, as a result of the cost of living crisis, is facing a perfect storm of surging demand, increasing costs, and increasing and decreasing budgets. So, in terms of their capacity, when you're talking about, you've got the larger voluntary organisations, but then you've also got all the really, really small ones that contribute to care at a really local level. So for them, the capacity to contribute to this type of process is going to be really, really challenging. And I don't think that's... I think there's currently a lot of weight on the secondary legislation for the bill, perhaps more than there maybe needs to be.